That parasitic intestinal infection making thousands of people sick across the U.S. shows no signs of slowing down. The CDC says an additional 6 states are reporting cases of cyclosporiasis. More than 22,000 cases have been confirmed or suspected in 47 states. Earlier this week, Michigan reported the first 2 deaths from cyclosporiasis. Both had significant underlying health conditions. And the United States is not the only country suffering from the outbreak. Health officials in the United Kingdom announced a sharp rise in cyclosporiasis cases among travelers returning from Mexico, they say. So should we be concerned? Joining us now is former CDC Director, Dr. Robert Redfield. Nice to see you, Dr. Redfield. Thank you for joining us. I was looking into this. We know the incubation time for the symptoms is about 2 weeks from what I've seen. So is this outbreak actually spreading, or is this just an uptick in cases from people who ate this recalled lettuce a couple of weeks ago?
You know, Brian, I'm concerned. I think, we'll know more of that answer in the next week or two, as you pointed out, because they have pulled this suspected lettuce off the marketplace, and whether these are just old cases that are getting identified now. But I do know, we're seeing some outbreaks linked to parsley and cilantro, particularly in North Carolina. So I would keep an open mind. I mean, this is clearly the largest outbreak of this pathogen that we've ever had in the country, as you noted. Clearly, the center of gravity of the outbreak was Michigan, which has had an enormous number of cases themselves. But I'm not certain that we have this all identified yet.
There were 2 people that died in Michigan from the parasite, but they apparently had underlying conditions. What would you say to people watching who may be concerned that they ate some of this recalled lettuce, that they have an underlying condition? I mean, there's this incubation period. Should they be concerned?
Well, if you have a diarrheal illness that's lasting more than 48 hours, okay, I mean, the challenge with that, it can lead to dehydration, and that can lead to problems. We've had over 500 cases now be hospitalized, and you mentioned we had 2 unfortunate deaths, both of which were due to dehydration in patients with underlying conditions. I think the best thing, obviously, is to be cautious about the raw vegetables that you're eating right now. The safest thing to do is get locally grown vegetables. I mean, because the real risk is these internationally imported vegetables right now. The only way you get cyclosporiasis is you have to eat vegetables. Lettuce is a big one, cilantro, parsley. We've seen it with blueberries, raspberries, snow peas. But you have to get those vegetables that were contaminated with human fecal material. And so it's pretty, and it's not something we see a lot in the United States. So most of the times we've had these outbreaks over the last 10 years, they've come from imported produce.
Okay.
And so, again, people can go support their local farmer, get their produce locally. I think they'll be totally safe.
Yeah, that's what I was just thinking. Good excuse to go to the farmer's market,
Farmer's market and support them.
It's better anyway.
It's better anyway. No, you can also get rid of it by cooking to 158 degrees. This parasite's very hard to wash off. All right, so if you wash your lettuce and you put it in a lettuce spinner and you have Cyclospora in that lettuce, it's still going to be there. You can't wash it off. So stay away from bag lettuce. Support your local farmers right now for your vegetables and produce, and that's really my advice. If you do get sick for more than 48 hours, you should seek medical attention. We can treat this. It's actually susceptible to an antibiotic we call Septra or Bactrim. So rather than take them, 2 to 4 weeks to get better, you might get better in 5 days, 5 to 7 days.
Okay, that sounds good.
When you're having diarrhea for two weeks or a month, and particularly a problem with immunosuppressed patients, people with HIV infection, they could actually be symptomatic for a month.
And this piqued my interest, maybe just because I eat a lot of Chipotle, but Chipotle announced that they've removed jalapenos from pretty much all of their restaurants after they were suspected in a Salmonella outbreak. 110 people have been sick just in Minnesota alone. How concerned about that should we be?
Well, it's another foodborne outbreak, and there's now similar cases in Colorado. It does seem to be that a majority of the people that have come into the outbreak investigations in Minnesota is where the large one was early reported. I think about almost 87% of them gave a history of eating the jalapenos. So that's where they came down to that. It's a different pathogen. Normally, when you get salmonella, you get the same problem, diarrhea. You can get dehydrated. But with that pathogen, our best treatment for you is just to keep you hydrated. It's not good to use antibiotics. If you use antibiotics, you're much more likely to become a carrier, a long-term carrier of the salmonella. So we don't recommend antibiotics in that case unless you're really seriously ill, you have a bloodstream infection. The difference with that, too, and to contrast them, Cyclospora has no risk to your family. If you're sick with cyclosporin, it doesn't go human to human, okay? So it has to, if you're infected, the feces have to go into the parasite has to go into the soil, into the environment for about 2 weeks to mature to a different form that then can infect another human being. With salmonella, the real risk is human-to-human transmission. So you always hear the salad worker at a restaurant has salmonella and gives it to everybody in the restaurant. So they're very different. The last thing I want to say on this is this should just underscore to the American public how important it is for us to increase our investment in both CDC and the FDA and USDA to have really robust programs for food.
That's a good point. Yeah,
unfortunately, they've scaled them back.
Yeah, that's we had a doctor on yesterday, sorry to interrupt you, saying the same thing. We'll keep an eye on it, though. We always appreciate your expertise on it, and we'll be a little careful of those jalapenos Chipotle right now. Dr. Robert Redfield, no Chipotle for you tonight. Thank you for coming on.
Bless. Yeah, bye-bye.
Okay.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.